Today, I am thrilled to introduce our guests for our very first live podcast that you all get to be a part of, and I can't wait to see where this next year takes us. So please welcome to the stage, Rob Biernbaum.
Yeah.
All right. Well, this is Rob, as I introduced, and he is the Chief Medical Officer at WellNow Urgent Care, providing clinical leadership across more than 150 urgent care locations nationwide. Previously held senior executive roles at Trillium Health and other major health systems. Rob, I almost said doctor, but we'll get to that.
Yeah, not doctorally. No.
Earned his Doctor of Osteopathic Medicine from the University of New England College of Osteopathic Medicine and completed his residency training in emergency medicine. Welcome to DX the Podcast Live, Rob.
Well, thanks for having me. I'm excited.
Yes. So it may surprise some of you in the audience that instead of focusing on clinical topics today with Dr. Biernbaum, I did it again. On purpose, but that's okay. I want to shift the conversation to business. So earlier this year, if some of you have listened in to DX, I spoke with Dr. Curtis Franke, and he said something that really stuck with me. He said, clinical leaders have such a huge piece to play in the business space. They can advise, counsel, weigh pros, cons, risks. Clinical leaders should be used more in that way and basically exposed to kind of those aspects of the business. We're not just here for our medical degree, is essentially what he said. So I love that perspective, and I know you specifically share it too. So I really want to hear your point of view on the role of physicians and what they can and should do in the business world, and why it's still so challenging for us doctors and physicians to think of terms like patients and consumers in the same conversation.
Oh, it's such a great question. So, it's interesting. This question was asked. We had a town hall, and we allow our team members to just pretty much ask what they want. And they're like, why are we calling these people customers and consumers? And they directed it at me. And, I sat there and I thought, well, listen, we all know this. The people that we take care of, first and foremost, they are our patients, right? So the minimal standard is an excellent quality of care.
Absolutely.
So in order to practice, we have to practice at the highest level, give excellent quality of care, or we shouldn't be practicing, right? So that's the minimal standard. But the other thing that I mentioned was, so you're practicing at that standard, but we're not robots. We sometimes put our titles in front of things as a way to hide from really bonding with someone in front of you. And I actually remember a story. It was my second year of residency. And these parents rushed in through the ambulance bay, this is in Flint, Michigan, and handed me their child.
Wow.
I happened to be the first, person in scrubs, handed me their child who was having a severe, respiratory issue and went in and ended up having to intubate the child and sat on the floor with the mom, and just talked to her and held her hands. And I tell that story because the reality is these are both our customers, our patients, the consumers of actual healthcare. And if we just see them as someone that we take care of and not engage them into the conversation and not realize that they're already the person who's going to tell you the story that's going to get you 80% closer to a diagnosis, then we're missing the boat. And then the other thing is, as customers, you get to do fun stuff, right? So we have slushy machines. I'm actually not kidding you. We have slushy machines in every one of our waiting rooms. And we actually had a kid tell us that they actually sometimes fake being sick so they can get a slushie. But you think about it, it's that extra thing. And I think that really kind of divides the difference between you always want to do something extra. You want to thank people for choosing you because they're trusting either you and they're the patient or their child in a time that they're scared, afraid, injured. So you need to make them feel like this is actually more like their home and you're there to have a conversation.
Love it. Super powerful. A really great perspective because as you and I both know, in training, the word customer and consumer is never used.
Well, it's also deemed negative.
Correct.
Yeah.
So it's an entire culture shift to actually bring these providers on board to recognize kind of what direction we need to go in healthcare.
Absolutely.
All right. Well, looking back, you started your career in medicine as an emergency room physician. And this was actually, we talked about this, before Press Ganey existed. Amazing. I'm like, what? So, can you share how Press Ganey was viewed in the ER during the early 2000s and how those past experiences actually shape your decision making now and your definition of what is successful for a patient experience?
All right, so I'm openly going to say Press Ganey came out in the 80s. It just wasn't wildly accepted, so I'm not that old, okay? So, like, I'm going to just say, listen, I'm not that old, okay?
I had to just do it.
But it was good. So, but hospitals didn't really adopt it. And I remember, so we're in an inner city emergency department that had a lot of, gun trauma, and they bring out this thing called Press Ganey, and they then tell us that our patients, now keep in mind, they were only patients back then, our patients are going to
not
rate us.
Not consumers, not customers.
Oh, no, definitely not customers or consumers in the ER in like the late 90s, early 2000s. So they're going to rate us. And we're going to take that another step. They're going to directly rate the doctors. So, by the way, if you've all watched the show The Pit, so I'm going to start by saying, imagine a bunch of nurses like the charge nurse and a bunch of docs like Dr. Robbie. So it kind of went like this. Oh, that's cute.
Nice try.
Like, that's great. And I remember we got our first rating, and we were really good. We were in the 3rd percentile. And in case you're all wondering, that's like the opposite of where you want to be. And our chief, like, his job was actually on the line. I remember he sat us all down. He's like, we got to do better. And then, a bunch of the docs who are like the people who train me, they're like, they should be happy we take care of them. I don't care how they rate me. And like, we kind of rallied around our chief. And then we started to realize when you're super pleasant and you walk in the room, and instead of like immediately diving in, you introduce yourself to everyone in the room. And you have like, I always had like a little thing. Everyone has their own kind of spiel. I'm like, hey, listen, I heard you're here for this, but tell me about you. I want to hear what's going on. And you sit down. And we started to realize Press Ganey was important because it taught us how to actually just slow down in the moment and have that patient, that customer, that consumer realize that this moment is theirs. And that actually changed every way that we practice. And we always joke around when they asked us how we did it. We went from, like the 3rd percentile to the 99th. And our answer was, when you're laying on the floor, there's only one direction you can see, and that is up. Yeah,
that's fantastic. Well, super interesting to think about a time before, patient satisfaction surveys or Press Ganey scores, but I'm so grateful that we are focusing more on that to really engage the patients in their journey, which is theirs. It is their journey. We're just a part of it.
Absolutely. They get to pick where they go.
Exactly.
So.
Yeah. All right. Well, Xperity data shows that the typical urgent care center sees about 30 visits per day, but WellNow averages 40 to 45 per clinic. So tell us about a couple specific strategies that have driven your higher performance, maybe things like scorecards, et cetera, and how you kind of instill that mindset of continuous change in a business that must kind of, constantly adapt to survive.
So I think it starts when you start to realize who actually are the people who bring volume in, and those are the people who work in your sites, right? So just like our keynote speaker, we sat down with our clinic leads and our multi-site managers, and we started to realize that every one of their sites, which we then refer to, these are your homes. This is your home. You want to welcome people into your home. How do you do that? And we asked them to help us create a true scorecard. Like, you are going to hold yourself accountable. We want you to create a scorecard. And we broke it down by, we always have to talk about business. And it's so funny when doctors start talking to PAs and NPs about business, they're like, yeah, but I'm not the business person. I'm the person to take care of people. I'm like, we are actually in the business of medicine.
Yeah, it is a business.
It's an absolute business. So we started sharing all of it openly with actually everybody. So all of our information is transparent. And our MSMs help build their own daily scorecard, weekly and monthly scorecard, and they gave themselves, how do you get to certain grades? And it was interesting, bringing them in versus forcing them with something which by the way, we all know doesn't work. I mean, you always think about your children. How do you actually get your children to do something
Tell them the opposite.
Well, yeah, when they're 15 years old and you want them to do something, you just have to engage them. You got to engage them in the conversation. So we did that. And, the next thing we did is we started talking to our medical staff members. And we don't separate medicine from operations, from finance, from rev cycle. What we say is everyone is operations. All of us are operations. All of us lead operations. We just are a different part of operations, right? So we started to ask our medical team, our clinical people, what do you think patients want that are urgent care or urgent care adjacent? And I know, not shocking to probably anybody, but they came up with great ideas, right? Because they're the ones who see this every day. And we gave people permission to truly lead their own sites. And then our job was to ensure that whatever barriers they raised their hand was to remove them as fast as we could. So I truly think transparency. And then the other thing we instituted is a walkout is a lost opportunity, right? So you think about someone comes for care and then they leave.
Right.
And
it took a lot of effort to just get there.
It does. Or they sign up and they don't show up. So the MSMs, which to this day, I can't believe they wanted to do it. They actually chose that if someone signed up for an appointment and then didn't come in, they call them. And if someone was in the building and left before being brought back, they called them as well. And so they had the incentive to not let that happen. And when you think about walkout rates or no-show rates anywhere between, say, 5 to 15%, all of us are missing the volume that we should keep in. And we were able to get our rates so incredibly low, below 3%. Wow. So we just basically kept our own volume. And I think when you think about people who are seeing 30, 32, my question is always, how many people aren't coming in or walking out and you don't know?
Yeah, so looking at all the different levers and where can you kind of make micro adjustments and engaging your team fully.
Exactly.
Yeah.
And letting them be a part of the solution. I think that's something that old leadership is to basically push down an answer. Good leadership is to listen to your people, get them engaged, and no idea is actually a bad idea. It may not be something we implement, but we should hear it and applaud the person for bringing it out.
Absolutely. Love it. Love the perspective. Love the historical context of what you're able to bring and all the leadership that you bring to your organization and to the urgent care community at large. So can you all join me in thanking Rob for joining us on DX the Podcast?
Thank you so much for having me. I really appreciate it.
And we'll see you soon.